Hi, myself, Dr. Deepak Mehendru. I'm a consultant at Kalyani Hospital, Yamunanagar. Today, we are going to discuss latest updates in hypertension. So, as per WHO, nearly 63% of the total deaths in India are due to non-communicable diseases, out of which 27% are attributed to cardiovascular diseases, which affects approximately 45% of the people from the age group of 40 to 69 years of age. Raised blood pressure is among the most important risk factors for cardiovascular diseases. Moreover, it remains poorly controlled due to the low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. So in India, the prevalence has gone up to 30 years to 38% in men and 32% in women, from 29% and 28% respectively. This is the data from WHO. Despite that, nearly half of the men, or 50% of the men and 40% of the women with hypertensive, were unaware of the condition. Additionally, over 62% of the men and more than 53% of the women living with hypertension did not get treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. This is the data by WHO published in Lancet 2021. International Society for Hypertension, ISH, has released ISH 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigm attempts to address the issue that is in the resource poor settings. Optimal care refers to the evidence-based standard of care, and whereas essential standards refer to the minimum standards of care to allow specification of the essential standard care for low resource settings. American Heart Association and ACC released a scientific statement in 2021 offering the new guidelines for the management of stage 1 hypertension among the patients with low SCVD risk. Among the low risk adults with no CVD risk less than 10 years with stage 1 hypertension and the blood pressure ranging from 130 to 139 over 180, 89 mm of mercury. Management starts with non-pharmacological therapy. If blood pressure remains uncontrolled at 3 to 6 months, consider starting a pharmacological therapy as mentioned by Johns W. in Hypertension 2021. Acute respiratory distress syndrome is potentially a fatal condition involving lung damage, and experts often associate it with the severe COVID-19. A recent study which appeared in the Journal of American College of Cardiology reports that metoprolol can reduce lung inflammation and improve respiration function in the people with COVID-19 induced ARDS. The study was published in Cardiolon in 2021 September edition. Lowering systolic blood pressure targets down to the 110 to the less than 130 mm range substantially reduce the cardiovascular outcome events in STEP randomized trial, affirming the sprint findings for the whole Chinese population. Among 8,500 patients aging from 60 to 80 in China, the intensive target trimmed 26% of the composite cardiovascular risk. Findings from now a second major trial supporting a lower target could unite the guidelines, which even among US professional societies ranges from the threshold of 130 to 150 mm of mercury. Told you that it was published in New England Journal of Medicine in 2021. Regards to prognostic value of the ambulatory blood pressure monitoring and the nighttime blood pressure, the 2018 European guidelines on the management of the arterial hypertension recommended that the diagnosis of hypertension should not only be dependent on office BP measurements, but also on the out-of-office measurements such as ABPM or home blood pressure monitoring HBPM. 24 hours and nighttime blood pressure measurements were also associated with a greater risk of mortality and a composite of severe outcomes. Thus, they may be considered as the most relevant measurements for estimating severe risk. For every 10 to 20 mm of HA increment in the blood pressure measured at night, the risk of mortality increases by 23% and the risk of cardiovascular events increased by 36%. Most of the patients with hypertension require lifelong medical therapy to achieve optimal blood pressure control. The 2018 European guidelines even recommended 5 classes of antihypertensive drugs considering high non-adherence treatment. The importance of combination treatment is particularly highlighted to improve the adherence to the therapy and blood pressure control. Therefore, the 2018 European guidelines recommended, especially in the context of lower BP targets, to start antihypertensive drug therapy with an initial fixed dose combination of an ACE inhibitor or ARB with addition of a calcium channel blocker or a diuretic. Since early July 2018, products containing valsartan have been recalled worldwide. The reason is the detection of a known carcinogen, namely N-nitro sodiumide methylamate (NDMA), which can be found in candesartan, ebrisadin, losartan, olmesartan, and valsartan. NDMA has been classified by the WHO, International Agency for Research on Cancer, to be carcinogenic in humans. If 1 lakh patients would have been received NDMA contained valsartan from the manufacturers every day for 6 years, in the high dose, it will result in 22 additional liver cancers over the lifetime of these patients. The presence of NDMA in these drugs could lead to 8 additional cancer cases in 1 lakh patients. If they had taken highest dose over 4 years, valsartan recall accompanied by a significant increase of the rate in emergency department visits by 6%. The HYGEA study represents the largest study that tested nighttime antihypertensive treatment. In this trial, chemotherapy was associated with a significant reduction in the endpoint, including death. The HYGEA chronotherapy trial tested whether the nighttime therapy in comparison to usual upon awakening hypertension therapy exerts a favorable CV risk reduction. The largest study included in total of 19,084 hypertensive patients during an average follow-up of approximately 6.3 years. 1,752 participants experienced a primary CV outcome, and ambulatory blood pressure measurement was performed 48 hours to collect how BP differed during the sleep. The RR reduction for CV events was significantly improved for nighttime treatment when compared with the awakening treatment. Thank you.